Well, good afternoon, everyone. Yesterday was a hard day for the island. I was touched by the expressions of solidarity and determination that I heard. The Minister for Health and Social Care is with me today, and before I hand over to him for his regular update, I would like to make a point of my own around testing. Some people have told us that we should be testing more. I agree that testing, along with the actions on self-isolation and social distancing that we have put in place, lie at the heart of our ability to reduce the impact of the virus. But we have to test in line with the best clinical advice. We have to prioritise. We have to target. I am proud of what we've already put in place. Our teams swabbing at the mobile centre and out in the community are doing a great job. It is a labour-intensive process. Our on-island testing facility is of course to be operational in a couple of weeks, and this will allow for a quicker turnaround. For our small population, we are doing well. I looked at the statistics this morning. To date, the number of tests we have done equates to a rate of almost 15,000 tests per million population. Compares to Jersey in the Channel Islands at just below 10,000 and Guernsey at just over 11,000. I know that our population size does make direct comparisons difficult, but even South Korea, who are often cited as the gold standard, are at under 8,000 tests per million. Of particular relevance to us, of course, is the United Kingdom, who are currently at just over 2,000 tests per million. Even their 25,000 a day would only equate to 6 a day in the Isle of Man. We are doing considerably better than that. Let me now hand over to the Minister for an update on the figures as they stand this afternoon, and I know that he wants to cover other issues. David.
Thank you, Chief Minister. In relation to testing, we have now in total undertaken 1,334 tests, where that means we've had returned 1,147 tests, and we're awaiting results of 187 tests. We have also conducted a further 86 tests today that will be sent away. The total number of confirmed cases now stands at 95. And the total number of hospital admissions currently stands at 4. Alongside the testing, today I want to talk about the measures we are taking to ensure our health and care staff are protected as they go about their important work. One or two alarming stories are doing the rounds on social media. They are very wide of the mark in what they are saying, and they are causing unwarranted fear among staff. We must scotch the scaremongering as we are talking about staff on the front line, whose safety and well-being matter enormously and are crucial to our entire COVID response. This is too important to leave unchallenged. Staff safety is about providing the necessary protective equipment in the right place at the right time, and it's about communicating that clearly. We have done both. It is absolutely essential to stress that the decisions around the use of PPE and where it is and isn't appropriate is not a political decision. It is a clinical decision decided on by our clinicians. Where it is clinically recommended, PPE is available and will continue to be. This guidance has been increased since January, as you'd expect in anticipation of a COVID outbreak. It continues to be updated, in particular for staff involved in treating patients with the disease, and we continue to update our staff based on the best clinical advice. The guidance we have is precise and specific. It sets out that the requirement to wear protective equipment depends on the procedure being carried out and specifies the circumstances in which items such as gloves, aprons, gowns and visors should be donned. Staff in health and care settings have already been trained in the use of protective equipment. It's a fundamental part of their training, essential to prevent cross-contamination ensure patient safety, which is of course our highest priority. That is the starting point. Information and advice regarding personal protective equipment, or PPE as I refer to it, and social distancing in the workplace have been communicated across DHSC. There have been 2 communications circulated to staff in the last week alone. This is reinforced by managers and supervisors. It's what we are doing on a daily basis. Infection control practitioners are answering queries every day and visiting areas to reinforce the public health guidance on PPE. We have had consultants visit groups in the hospital, including porters, housekeepers. They should take in their different roles. The team remains available to answer any queries. This training we give is standard and consistent, and also delivered by expert staff. Education sessions have been held to explain policy and protocols. Demonstrations of the correct way to put on and take off PPE. At present, GPs and nursing staff taking swab tests from members of the public routinely wear PPE, while staff in other areas of the hospital and health and care settings have been advised on what is appropriate and provided with the necessary stocks. There is an array of clear guidance for those working in residential care and supported living environments, and this is all easily accessible on the government's website to support and protect our most vulnerable residents and clients, and also, crucially, the staff looking after them. Our stocks have been centralised to ensure they can be monitored so that health and social care staff get the correct PPE at the correct time. Supplies continue to be ordered and received by DHSC, and while worldwide demand is at record levels at present, we continue to work relentlessly on ensuring there is no shortage in the Isle of Man. Understandably, there has been discussion of how we will deal with increased demand, the expected surge. We are doing so much to try to and suppress. We have looked at the options for a field hospital, I can confirm that, and at the possibility of using the NSC for non-COVID patients. While that option was considered, I need to be absolutely clear. The NSC is staying as the NSC. There are no plans to turn it into a morgue, which quite frankly is pure scaremongering. We are looking at ways to add extra resilience into bed space at the hospital, and we'll be building some additional capacity. We are looking at utilising some of the existing facilities we have on the Nobles estate, including Newlands, to provide additional ward capacity for COVID patients. These facilities are well suited to this, and our colleagues at DOI will soon be looking at carrying out works to adapt, extend and prepare these buildings for their new temporary use. At the same time, we continue to make best use of Noble's existing bed space. As previously announced, the private patient unit will also be being brought back into service in this regard. We also plan to block book beds, which have recently come on stream in the residential home sector, so that patients currently in Nobles can step down from an acute hospital bed to re-enablement as they prepare to return to the community. Together with the current halt on elective surgery, we are identifying beds across Nobles and streamlining the entire hospital operation. As Minister, I fully recognise that this is a scary time for all those involved in health and social care, and people quite rightly will have from time to time concerns. I would urge anyone with concerns to be open and honest about those concerns and seek appropriate advice. All of our procedures are there to protect our frontline staff, and that is an absolute imperative for us. But equally, it is important that where false information is put out publicly, that it is robustly challenged. I would like to end by once again thanking all of those working across health and social care for their continued commitment during this difficult time for our island. Whatever role you play, whatever role you may have, you play an important part in our fight against this horrendous, invisible disease. And for that, I would like to sincerely thank you all. Thank you, Chief Minister.
And thank you very much, David, for what I know is that was a comprehensive update. Now, before we take questions, I do want to address another story that has attracted some attention on social media, on which I know there will be a debate in Tynwald tomorrow. Namely, the Isle of Man residents who did not make it back to the island before we closed our borders. Now, we have not lost sight of these people. We continue to examine how we can help them. I know that this is an emotional question. We have to balance the few who are stranded with the welfare of the whole island population, and particularly the most vulnerable. But I know that my officers recently, in the last hour, have just come off a phone call with the United Kingdom government, where we have obviously been discussing those who have been stranded and repatriation. We will get this sorted. We will do the right thing at the right time. But I have to make it clear that we will only allow them back to the island when our clinicians judge the time is right and that the process put in place is sufficiently robust. We cannot be driven by our emotions. We need to make decisions on the basis of the best advice available. We cannot afford to import more risk to the island. Before we go to questions, I would like to share with you some of the details of inspirational heroes from across our island community. As always, there were so many stories that touched my heart. Do take a look yourself on our social media channels to see how our island is rising to the challenge. 3 that caught my attention were: first, I have a lot of praise for our refuse collectors across the island, and rightly so. Keeping our community clean is key to keeping us healthy. Unsung heroes, refuse collectors, thank you so much. The second group, I have a lovely message from Katie Watson about her dad. He has been working long days delivering plants for free to people who are locked down to bring some joy to them. Thank you very much. Third, a number of you have asked me to thank our pharmacists, and I am delighted to do so. Not only are they, of course, providing access to important medications, but we are hearing stories about them going the extra mile for their communities. Thank you to all of these heroes. At this point, I will take questions. And first I have down is Chris Cave from Energy FM. Chris.
Good afternoon, Chief Minister. Obviously, it was extremely sad hearing the news last night that coronavirus has killed its first victim in the Isle of Man. And naturally, my condolences go to the family and friends of this person at what must be a very distressing time. We're told we need to be ready for more deaths, which brings me on to a very sombre but salient point. Funerals are how friends, families and communities say goodbye to their loved ones and often find some sort of closure. How will they be affected by current government guidelines? And I'm not just talking about those victims of coronavirus, but all those who may lose their lives during what we all now know are unprecedented times.
Well, my belief is that at this moment in time, I'm afraid, unless you are immediate family members, and it will be restricted, you cannot go to a funeral of anyone on the Isle of Man. I know that a company approached us to see if they could do live streaming, and that could be an option for people who want to watch a funeral of a friend, and that's something that is being looked at as we speak. But at this moment in time, as awful as that it may be, there can be no mass gatherings for funerals, and it will be restricted to immediate family only. And if I hear any different, I will, of course, update you on that.
Thank you. My second question for the Health Minister, please.
Okay, David.
Good afternoon, Chris.
Good afternoon. We've seen high-profile people being diagnosed with the virus and then making public statements saying they're now free of it. 95 people have now tested positive for coronavirus on the island. Does that mean 95 currently have the disease, or have some who previously tested positive since recovered?
At the moment, we don't have anyone that meets the medical bracket for recovery, but we will be reporting on those statistics once we have them. So I will be adding to my daily update when we have people who are in that bracket, the number of cases recovered, and that will then be able to give us the amount of active cases on the island as well. So people will be able to see a better picture. Obviously, at the moment, the only thing we can report is the total number of cases, which is only ever going to go one way. Once we have people who classify as medically recovered, based on because it's based on when they were first diagnosed with symptoms, then we will be able to report on that, and we fully intend to.
Thank you very much.
And thank you very much, Chris. Now we move on to Josh from ITV. Josh.
Thank you, Chief Minister. Obviously, our thoughts are with the family and friends of the individual who has passed away. But following that, does this cause any immediate changes to the lockdown period that was set? Obviously, it was originally 21 days. Will that now be extended? And if not, what sort of things are you looking at to judge whether to change the lockdown duration?
Right, well, first and foremost, no, this changes nothing. It was a great tragedy. It was a very horrible day yesterday for all of us as an island community. But no, we carry on with our plan. Obviously, we've brought in all the procedures so far and shut the island down from people coming in, bar the obvious exceptions, so that our medics can look at the spread of the virus, get a clear indication of where it's going, and they will then be able to advise the Council of Ministers and therefore Tynwald on what decisions we need to make. But at this moment in time, the clinicians are getting together the data, and it will take a while whilst they follow the trends of the number of cases and the spread and the groups, etc. So no change because of this untimely death.
My second question, I know you mentioned that it was going to be discussed tomorrow at some length, but I've spoken to one individual today who is one of the stranded Manx residents who can't get back, and they're seriously worried about their mental health. They were afraid of being identified and speaking out because they feel the government has abandoned them, and the backlash that they've had on social media has been described as spiteful. Is this the message you really want to be giving to the stranded Manx residents who are still part of the community?
Well, no, the government hasn't abandoned them. We have registered them with the FCO if they're off island, and the vast majority of people who were waiting to come back to the Isle of Man are not in the United Kingdom. They are scattered around the corners of the world. We have, as I've said before in my earlier speech, we've got officers working with the FCO in the United Kingdom to ensure that when the UK are able to do the planes into the repatriation into the various countries, that they are aware of our Manx residents who are stuck there. That is what happens across the world with all other countries, and we have treated our people exactly the same. We have been putting that in place, and obviously we have a team who have been in contact with those who have contacted us with their issues, and where they have serious issues we have obviously been working behind the scenes and giving advice. So it's not a case of abandoning them. What we've had to do is for a short period of time work out what is the situation on the Isle of Man with the spread of the virus, what is the situation with the United Kingdom spread, and then when our medics feel that it is safe to bring these people back to the Isle of Man and put them in various isolation points on the Isle of Man, then that will happen. That's something we've always planned for from day one, but we cannot do it until we receive the advice that it is safe for all of the people on the Isle of Man, for our own remaining residents to come back.
Thank you.
Thank you. Sam at Isle of Man Newspapers.
Good afternoon, Chief Minister. We're going to ask about, we've had an email in today about nurseries in the island who are concerned that they're falling through the cracks here, that is available for business support, and yet they thought they might be included in the educational grants, but they won't be available for that because they have more than one employee due to the requirements of their business. What support is going to be given for nurseries? Because obviously Ireland only has private nurseries, and they're concerned that at the end of this they won't survive financially.
Well, obviously that's something I'll have to ask the Minister for Treasury and the Minister for the Department of Enterprise on that as a specific detail. Obviously, that sort of technicality is not something I'm not saying I don't get involved with, but it's I'm dealing with the health and the generalisation, individual areas. If if you want to contact me before I come on, I'm more than happy to have the answer for you, and I will ensure that the next briefing that is answered on the nursery side of things. And your second question?
So secondly was for the Health Minister, that's okay, please.
Okay, David.
Good afternoon, Sam.
Good afternoon, Mr. Ashford. It was just a case of figures in the community. Obviously, we've had it where families are being told if one person has it, then it's to assume that other people haven't, they're being told to isolate. But also in the Independence Day, we have a story about how the belief amongst medics is that the coronavirus is more widespread in the community. Do you have an estimate on what this figure actually is beyond the 95 positive tests?
I've been asked this before, or either that or I've dreamt the fact I've been asked this before, and the simple answer is there is no way of doing that. No country on earth's been able to make an accurate prediction on that. For instance, in the UK, the estimates range from there being an additional 10,000 cases to 20,000 to 30,000, depending on which daily newspaper you read. The whole point of testing is to identify the chain of the virus and break it. So the point of testing isn't to get a pure stat as to how many people have the virus or have had the virus. It's in order to identify people, isolate them and the people they've been in contact to stop the spread through the community. And I think sometimes that causes confusion because a lot of people seem to think the testing is there to tell them whether they have it or not. It's not. It's there to be able to break the chain. As with any virus, there is never going to be firm stats, particularly around the fact that some people don't even show symptoms. Some people it will feel like they've just had a mild cold, but they've actually had COVID-19. So there is never going to be an accurate picture in that way.
Okay, and just in terms of that then, is something that we've also been asked is, with you say about breaking the chain, people are wondering, is the same thing happening here that's happening in the UK where we're seeing hotspots of the virus?
At the moment, no. One of the things we were looking to do was record it all by postcode. Obviously, we are seeing more in the IM2 postcode, I believe, but that is Douglas, of course, generally, where we have the higher percentage of the population anyway. So if you actually look at it as a hotspot, I suppose you could classify that as it. But the health warning, if that's the phrase to use on that, is, of course, it's also a very highly populated area.
Okay, thank you.
If I can just come in on that point, on the questioning, I think the Health Minister was right. There's no clear example throughout the world, but let's look at the Isle of Man. I've just given you figures that show the Isle of Man is probably one of the best countries in the world to be doing the testing, 15,000 per million. If you look at other countries which I named who have been held up in high regard, and because we did not stop our testing in the community, unlike the United Kingdom, whilst we cannot say how many people we think have got it in the community that aren't showing any signs, we are able to have a really good set of figures on those that do have it because we are testing everyone. Now, I think we peaked at over 110 tests in one day, which is some going, and I really want to pay tribute to our testing teams, both the mobile team and those that are going to people who can't get out of their house, are vulnerable people, to do the testings. And because we are doing this phenomenal amount of testing, then we can say that our data can be as good as it possibly can be. So moving on now to Tim Glover from Manx Radio. Tim.
Last night, Chief Minister, and obviously thoughts very much with the family and friends of the deceased, who, of course, tragically wouldn't have been able to be there at the end because of this horrible virus that we're dealing with. You mentioned bin men, and I think I've mentioned previously I applauded our bin men one morning as well here when they were collecting the bins. But are you in any way concerned about potential pest control issues? And I can't say the word as a Manxie, obviously. We've got garden rubbish building up, bring bank items piling up, many bins filled to overflowing because there's more people at home, so there's more rubbish being generated. And a big issue seems to be dog fowl bins not being emptied around the island. And I've seen it flung into hedges and fields. So are you worried about a potential pest control issue?
Well, obviously, we have discussed this in the last couple of days in the Council of Ministers, this very issue. And I know the ministers of DEFRA and DOI are looking to see if a process can be worked out with the support of our head of public health to advise us on, is there a way that we can try and alleviate this situation? But obviously, that's something it's highly complex. We're looking at 1,001 issues at the same time, Tim. But yeah, it has already been thought, this process. Long tails, ringies, whatever, we do have to make sure that they are controlled. And, you know, if we can come up with a solution that doesn't impact the spread of the virus, then of course we will announce it. But if I can point out, you know, where week one through, we've got another couple of weeks, I don't think it will explode out of all proportion, this problem, in that period, and hopefully by then we will have been able to work through a solution going forward.
Thank you, Chief Minister. Could I ask the Health Minister a question before I finish?
Yes,
thank you.
Certainly.
I don't envy you your job. So many things.
Good afternoon, Tim.
Good afternoon, David Faster-My. Most of the questions I had to you, you've already answered because they've already been asked. And it is about clusters, it is about cases being linked. So I think we're getting asked that more than anything else at the moment. We're 2 weeks on, I think I'm right in saying, from the first case being revealed on the island to the day. And 27 new cases in one day is the biggest surge I think we've seen in the figures. Do we have an indication as to where we're aiming to, what the curve is likely to get to, and what we're looking at trying to flatten?
Well, obviously, we have projections as to where we believe the curve is going and the different actions we're taking. But to be perfectly frank, it is still early days yet. We know we are roughly in line with where we expected the modelling to be with the suppression actions that we've taken, but it is still far too early to tell, to make a confident assessment. We need to have at least the next 2 weeks to be able to get that fed into the modelling software for the clinicians to be able to make a firm judgment on that.
Thank you, Minister.
And thank you very much, Tim. We now move on to Mr. Paul Moulton of MTTV. Paul.
Thank you, Mr. Quayle. Thank you. Obviously, you've seen that Guernsey has now got testing on island. That's moved very quickly. They managed to do that, which will help the time lag from people getting tested and getting the results. Are you disappointed that we're still not in that position? And how long do you think it will be until we get to that position?
Well, first and foremost, our team are working exceptionally hard. We now have all the equipment on the island, but you have to make sure you've got your testing in place and make sure the procedures are correct before you go ahead with it. So we're still saying the middle of this month, so a fortnight, just under a fortnight, we hope to have our own testing. I think we had a very good relationship with the United Kingdom on their labs. I spoke to my colleagues in Jersey and Guernsey in a conference call the other day, and they had been going days without getting results back. I know people were incredibly frustrated at having to wait for more than the 72 hours which we hoped. That's what we expected the process to take, but we are in a much better position, and as I say, we will have our own system up and running within a fortnight. I know Jersey are in a similar position to us too. They're not too far away either.
And the second question to Mr. Ashford, I think this will be for you, sir.
Okay.
Hello, David.
Good afternoon, Paul.
When someone's proved that they've got it, they're proving positive, but then you start this tracking business, finding out who they've been in action with. I was hearing that it had to be over 15 minutes. Is that just one of those things you hear in the streets that's wrong? Is it anybody that's come into contact with that person that qualifies, like someone working in a shop, or getting on a bus, or is it over 15 minutes or something like that? Can you clarify, please?
It literally depends upon the circumstances for that individual person. So there is protocols around various scenarios. Obviously, the borders at the moment are closed, but there's protocols around people who may have been on a plane with someone, which people on that flight need to be contacted. In other words, the people immediately next to them, the people immediately in front of them with the 2 metre rule. There is also those that they may have had touch interaction with. So, for instance, if they're paying someone in a shop, etc. There's those various different protocols that are then looked through and worked through with public health. So it's not a swift, fast and simple side of A4 that says these are the people you contact, these are the people that don't. There's a whole set of protocols depending upon the situation that the ordinary person's been involved in. But in terms of the 15 minutes, that's a World Health Organization guideline that your risk of infection increases if you have been with someone for over 15 minutes. It doesn't remove your risk of infection if you've been with them for less than 15 minutes. So it's a whole raft of different guidelines that come into play in terms of contact tracing.
Thank you.
So I'm afraid that's not very helpful, but it's as helpful as I can be.
Okay.
Thank you very much, Paul. If we come into Alex now from BBC.
Thank you, Chief Minister. You've indicated there is still no set plan to return those who are stranded off island presently. Until you can bring these people home, what support exactly is being offered to them?
Well, obviously, as the vast majority are out of the United Kingdom, and the FCO will look after them and repatriate them to the United Kingdom, and then we will obviously take the details. At this moment in time, our medics are looking at a system whereby we can bring people back on the boat and put them in a number of hotels where they will be made to self-isolate for the 14 days there. This has been worked on from day one, but obviously we needed to know the numbers. And initially, when we looked at this, based on the bookings that the planes and the boat had, the highest figure we were looking at was circa 2,000 people. Now I'm delighted that when the figures have now come in, it's less than 200 people, and obviously an awful lot of people made that decision, came back to the island, and those figures are much lower than we had initially been expecting. That said, it's still important for our medics to ensure that when these people are allowed to come back to the island, the process is correct to ensure that we do not have a spike all of a sudden in the number of cases on the Isle of Man as a result of that, because of it spreading with other people. So I think that's important. So obviously we have a phone line where we've been contacting the people, and the people have been advising us. I did say in Tynwald that at one stage we had 20. I've made regular updates here. That has been obviously increasing every day as people have got in contact with us to let us know where they are. Not everyone wants to come home. Some prefer to self-isolate because they're worried about vulnerable relations on the island and they're not going to come home. So some people obviously want to get home, and we are doing everything to ensure that once we have the right medical data on how we can implement that safely for the rest of the island's residents, we will of course do that.
These people are still facing an indefinite wait, be they in the UK or further afield. Some of them are running out of money, some are running out of medicine, most of them unable to get back and work. So what support is being offered to them while they're away? Well,
if you're off out of the United Kingdom, Alex, you wouldn't get support from the British government. If you were a British resident, you would get, if you were absolutely bankrupt with no family, friends, you might get help with the flight back, but with the cost, but you would have to pay that yourself. That is the standard procedure in the United Kingdom for people who need to be repatriated to the UK. We are obviously looking, if there is a severe social case or medicines, then we urge those people to contact our team, and they have been. We do know of a small number of people who have issues. If they have severe medical issues and that is a health issue, then they may be allowed back under that ruling on severe medical reasons, which is part of our ability to bring people back. But that is a medical decision. As I said, it's not a political decision, it's a medical decision, and that's the key element here. Of course, we all feel desperately sorry for the people who are not back on the island, but the decisions made were based on sound medical advice for the benefit of all of the people of the Isle of Man.
Thank you.
Right. Next we have, and last we have, is Rob from 3FM. Rob.
Good afternoon, Chief Minister. Our thoughts and prayers also with the family and friends of the person who passed away at what must be an incredibly difficult time for them. We do wish them all the very best. My first question is for the Health Minister, please.
Okay. David.
Hello, Rob.
Good afternoon, Minister. So my first question touches on one that's been asked shortly before. It was something that was sent to us today by a resident. Is there a feasible way to let the general public know whereabouts on the island, geographically, these cases are occurring? And I know that this comes within the bounds and restrictions of patient confidentiality, but is there a feasible way to do that and update the general public on a regular basis?
We are looking at whether we can report via postcode. So the first three letters of a postcode it would have to be. So the IM1, IM2, IM3, IM4. That's still being looked at the feasibility of that and whether it would actually provide any sort of useful data. Because to be perfectly honest, the cases that we've had so far have geographically been spread pretty much across the island. So as I was referring to earlier on with hotspots, although we've seen quite a few within the IM2 postcode range, we've got to remember the IM2 postcode range is a very urban metropolis for us on the island, so that would explain why we see the number of cases. But if we feel that it's significant and it provides something statistically of use, then we would probably be able to do it by the first three letters of postcode.
Okay, thank you. And my second question for the Chief Minister, please.
Thank you very much. Far away, Rob.
Thank you. Now, I know the Health Minister started in his statements about trying to address some of these rumours that have been going round online and describing, of course, those rumours regarding the NSC as pure scaremongering. What's being done to police the spread of misinformation around coronavirus on Ireland?
Well, obviously, we're following it, and where we see this sort of fake news, to quote a number of people, then we're trying to raise it here. That's why we've raised it in our profile. Obviously, we will be. I will hope we will be able to put it on our online, so that those people going online, if we've got a frequently asked question, we can put that out. But I've said in a number of briefings ago, please can people put on Facebook or other social media, be responsible. Do you really believe that? Did your mate tell you, or did you see it with your own eyes? And can you totally substantiate? Because, as I said before, there are an awful lot of vulnerable people out there in isolation who are self-isolating because of they're either over 70 or they're pregnant or they have underlying medical issues, and they are concerned by this misreporting of stories, and it really is concerning to them. So I just ask people to be considerate, that post only something that you personally know to be true, not what a mate told you or you've seen somewhere else on another hotline. I think we saw it. It was a dreadful thing where a member of our community, their family member died in the United Kingdom, and I saw Facebook swamped with people saying, oh, we've had our first death, but it wasn't on the island. That wasn't the story. And I just ask people to be responsible when they're doing it. Now, because of the media and because of the feedback that we get so quickly, I've already had requests from a large number of people. Will the Health Minister come back in and just give you the figures again on the number of cases that we've had today and the total number of tests, etc. So I'll just ask David to come back in.
Thank you, Chief Minister. More than happy to repeat the figures again. So the total number of tests now that have been undertaken is 1,334. We currently, of those tests, have 1,147 back. That means we're outstanding the results of 187 tests, and the total number of confirmed cases now stands at 95, and of those, 4 are currently within Nobles. Thank you, Chief Minister.
Okay, well, thank you all very much for your questions today. Thanks for everyone for watching. We hope you found this helpful, and please stay safe. Thank you.